Hello everyone, this is my second video response this week on herpes zoster, otherwise known as shingles. The patient is a 52-year-old male at the hospital accompanied by his wife and daughter. The symptoms the patient has is 8 out of 10 generalized pain. He reports having a rash on his back that has blisters and redness at the site. In the past 2 weeks, he's been reported having fatigue and has been taking time off from work due to his symptoms. The patient works in construction and has been sweating more often. The relevant history, the patient has never had chickenpox as a child. He hasn't been recently vaccinated because of being afraid of needles. He recently had lung cancer a year ago and had a lung transplant to his left lung. He also has sleep apnea, type 2 diabetes, and eczema. The physical exam findings were the patient is on the stretcher accompanied by his wife and daughter. He reports he's been sweating more at work and has been taking time off due to the pain. He reports 8 out of 10 pain that is between his back, his head, and legs. He has a red blister-like region expanding on his upper and mid back. I marked the site to monitor that. Lungs are clear, abdomen soft, positive bowel sounds, otherwise no other concern, and the skin is intact. The diagnostic is a herpes zoster. The patient has a rash with blisters with redness at the back and spine. He also has pain, which part of it is a headache as well. The patient is at risk because he had a lung transplant a year ago. The diagnostic testing is based off of how it presents with a rash. It looks like herpes zoster. You could do a PCR to determine if the patient has a virus or not. And you could also do some blood work to see if the antibody is present. The treatment for this is doing an antiviral medication, such as a cyclovir. Depending on how long the patient's going to be there, we could do IV or we can transition him to taking it by mouth. The patient could take Tylenol or NSAIDs for pain, and also an anti-itch cream could be given as well to put on the site of the rash. And that is my presentation this week. Thank you so much.